to be talking about broken heart syndrome today. Many of you may have heard stories of someone that has lost a loved one and then shortly after passes away themselves. And we thought this was a really interesting phenomenon because oftentimes the person that passes away has no physical apparent reason for doing so. They were in good health and they lost someone and now they passed away themselves. So strictly speaking, in a medical sense, broken heart syndrome is called stress cardiomyopathy or Takotsubo cardiomyopathy. And there's two different flavors, if you will, for the cause of stress cardiomyopathy. There are emotional causes and physical causes. So physical causes include things like stroke, having a seizure, or even an asthma attack, while emotional causes can include speaking in public, losing a loved one, or even having a surprise party thrown for you. But by and large, they result in the same thing. You have a flood of stress hormones that are released, and for unknown reasons, it causes the left ventricle to balloon up in size. And that's where the name Takotsubo comes from, because when the ventricle flows up like that, it looks like an octopus trap, as you can see. And in Japanese, octopus trap is Takotsubo. So when the left ventricle stretches out, the muscle fibers become stretched and it can't pump efficiently. The rest of the heart is still pumping normally or even more forcefully, but it can lead to arrhythmia. And it looks like a heart attack because you have chest pain, shortness of breath, and arrhythmias.
So as Renee just went over, she gave you the breakdown of the pathology of the disease. You might have felt like you're back in Dr. Lars' class. You might be having anxiety about that, but it's okay because we're done talking about pathology. Because when we're all medical professionals or aspiring to be medical professionals, and we know that it's important to have that background knowledge of the pathology, but that doesn't really give us the whole picture of the disease in terms of treating our patients. To get the whole picture, we really need to know more than just that pathology. So yes, this is also called Takotsubo cardiomyopathy, but it's more commonly known as broken heart syndrome. And that's because one of the main triggers of this disease is an emotional stress that comes in the form of a loss of a loved one or a spouse to the older adults. So yes, this is in medical terms, it's considered an acute disease, and this is because it only occurs in death or a fatal incidence in 1 to 3%. In most people, the heart muscle resolves in about a few weeks. But what we really wanted to look at was the emotional stressors that are there and that don't just resolve in a few weeks. And that these older adults are suffering from more than just the heart issues. They're also suffering from mental health decline in the form of anxiety or depression or just the grieving process in general, or also in other cases that after losing a loved one for about a year, that person who lost a loved one has increased mortality.
So like Lindsay said, this condition is fatal in 1 to 3% in the short term. And so a well-known example of this is in The Notebook when Noah and Allie pass away and Allie's bed together. But in real life, it also occurs. 39% of men who lost their wives are likely to pass away also within 6 months. So luckily, this isn't always a fatal condition. My grandpa, for example, has Parkinson's disease, and 2 years ago when my grandma, she was hospitalized and went into a long-term care facility, he, his health started to decline also, to the point where my family didn't feel he was safe living independently anymore. So he moved in with my aunt, and from there his Parkinson's disease progressed worse. He had been falling more. He was hospitalized a few times for fainting, and so because of that, he now has moved into an assisted living facility. And throughout the course of this, he's progressed from walking independently to using a cane, and now he uses a walker when he goes out into the community. So for my family, it was very obvious that his health started to decline after my grandma moved away and he was suffering from a broken heart.
And there's also been research as to why the loss or decline in health of a spouse can cause enough stress to take a toll on the body. in mutually supportive marriages that can act as a buffer against stress, and it also can act as a support system. And a lot of our older adults, this support system has been there for 40 plus more years. So once you take away that support system, there's already the stress of losing that loved one, but then there's also, they don't have the typical coping mechanisms that they used to have and lean on to deal with that stress. And then also spouses tend to support each other and monitor each other's health. So especially in our older adults, if their spouses might, help each other to remember to take medication, or maybe one spouse was the one who really did all the cooking, and you take that away and it's really hard to adapt to that in addition to already being in a stressful situation.
So I'm going to segue over into a conversation on the power of love. So 16th century Chinese philosopher Lao Tzu once said that love is of all passions the strongest, for it attacks simultaneously the head, the heart, and the senses. And I think this quote really rings true for sufferers of broken heart syndrome due to the loss of a loved one. They're demonstrating a phenomenon known as the mind-body connection. If you think of the body like a hierarchy, the brain's at the top, and it directly impacts everything below it in the hierarchy. So what you feel, what you think, the emotions that you convey, they all trickle down and have a physiological effect on these lower levels, including the heart. The body's response can be so intense to an emotional trigger for some people that their heart actually starts to shut down. And there are cases as severe as someone dying within minutes of their loved one due to the emotional trauma. But in addition to this mind-body connection, there's also a demonstration of the very real, deep emotional connections that humans are capable of with one another. For instance, one study looked at longtime couples. People have been together for 30, 40, 50 plus years, decades. And they found that when they sleep together, their hearts start beating in rhythm with one another. It's kind of like hitting two tuning forks and putting them next to each other until they reach the same co-resonant pitch. So this is a pretty fascinating concept. We're talking about people that have been together for so long and are so in tune with one another that their hearts literally start beating as one. So imagine the impact it would have on your body and your mind if this person that you're co-resonant with is no longer there. So we're talking about our two relationships that are at play here. It's like the mind's connection to the body and the emotional connection of one person to another. And both of these relationships contribute to the physical pain and suffering that's associated with broken heart syndrome.
So if you lose someone you're that close to, you're going to go through a grieving process, and there are many social factors that affect grief in the older population. Some of these factors include isolation, disenfranchisement, social devaluation, and caregiving. Isolation refers to the lack of transportation or the lack of mobility that will affect your patient's ability to have that social contact to help them cope with the situation. Disenfranchisement relates to the idea that the older population is used to people dying, so that they don't experience the same amount of grief, or they're used to it, so they don't need that extra help with coping. But this simply is not true, and this will lead to the elders to withhold their grief and not grieve properly. Caregiving is a huge role in the grieving process. If they are the caregiver and they just lost their loved one, they're going to grieve for their loved one. But also, as Jill mentioned yesterday, the loss of future, the future they plan with their loved one, or also they may build up resentment or frustration for everything that they've given up to become the caregiver, and now that is gone too. If you are someone that has just lost one but you have a caregiver taking care of you, you also do not want to be a burden during your grieving process, and that may also lead to withholding their grief. So what can we do as PTs with this situation is, as Amy Gurney, the guest speaker OT that came in, she talked a lot about that therapeutic use of self, and we need to just encourage our patients to go through the grieving process, whether it be art, writing, talking, or just physical exercise will help with the grieving process. And we can also be on the lookout to make sure they don't enter that chronic grieving situation or into depression, where if they do enter that, we need to make a referral to get their mental health assessed.
So just to kind of summarize, we started off talking about the scientific basis of the condition, but that really doesn't tell you the whole story, because as Lindsay mentioned, the heart gets back to normal within a couple weeks, but you have long-term emotional and psychological effects that have an impact on your physical health. And as Danielle mentioned, a huge part of your emotional health is connections with others. So that's an opportunity for us as PTs to recognize that our patient is having a tough time and to make a connection with them and be a support system for them. Okay.